Hi, my name is Chuck Bocci with Three-Dimensional Physical Therapy, and this is Dr. Kendall Keys. She's going to demonstrate what's called instrument-assisted soft tissue mobilization to Jake's Achilles tendons. It's something we do very often in physical therapy when somebody has a tendinopathy. That means some sort of pathology of the tendon. So think tennis elbow, golfer's elbow, patella tendonitis, Achilles tendonitis. Those are probably the four most common ones, and this metal tool can really help in the healing process. So next we're going to demonstrate. So next, Kendall is going to demonstrate instrument-assisted soft tissue mobilization to the Achilles tendon, which is right here. It connects the heel to the gastroc muscle over here. So you have the gastrocnemius, soleus, a little bit deeper over here. Both connect to the Achilles tendon, and you can have two types of tendonitis. Mid portion, which would be here, or insertional, that's where it attaches to the bone. So Kendall will place a towel down, use a metal tool at about a 45-degree angle, get a little lotion so as not to irritate the skin too much. And she wants to put a decent amount of pressure there. You see that she's pushing into the foot a little bit to give a little stretch there. It's okay to have some redness of the skin. You don't want to have any bruising afterwards. So you can see like a little bit of redness there. And let's just keep going until we see some little bit more redness. Go a little bit firmer too. Then you always want to check with the patient. Hey Jake, how's that feeling, buddy?
Great.
All right, you can tell by his voice he's really enjoying it. And what this is supposed to do when you have a tendinopathy, which again means some sort of pathology of the tendon fibers are aligned parallel to one another, and as you have like wear and tear of the tendon, it's typically a chronic overuse injury, so the tendons fray a little bit, and when they heal, there's some scar tissue, and if you look under like an ultrasound, you'll see it doesn't heal, the fibers are not parallel. So what we are trying to do here is actually cause some damage and inflammation of the tendon so that it breaks up, and then we follow this tool up with what are called eccentric exercises. So that would be, we'll show you that next. With Achilles tendonitis, the instrument-assisted soft tissue mobilization can be beneficial in the healing process, and then we always want to follow that up with some strengthening and some stretching exercises. So this one in particular is called eccentric calf strengthening. So the concentric phase of the muscle contraction is as he's going up, you can see the muscle, you can see the kind of definition of the calf muscle. The muscle fibers are sliding on each other like this, and it gets thicker. That's like if you make with your bicep, you see your muscle looks bigger when you bend your elbow. And then the eccentric phase of the muscle contraction is as the muscle fibers slide apart from one another, the muscle looks like it gets smaller, just like in the bicep here, it looks like it gets smaller, the muscle's elongating. All right, so the last thing Jake's going to do here is two different kinds of calf stretches. The first one is going to target the gastroc, which is the higher calf muscle. So you see his knees straight, his heel is on the ground, and he's going to be feeling a stretch up here in the calf muscle. Usually we'll do this like 3 times for 30 seconds at the end of an activity. And then Jake, can you move your foot like half a foot length up? Good. And then you're going to bend the knee. So now keeping the heel down, you see how it wants to come up, keep the heel down. Both toes are pointed towards the wall. Knees bent. He's going to feel it lower down here. Correct, Jake?
Correct.
So that's going to bias the soleus, which is the deeper calf muscle. It's located a little bit lower, and it doesn't cross the knee joint where the gastroc does. Not that that's really important. Well, it's important for this because when you bend the knee, it puts slack on the gastroc so that it targets the soleus. Some common mistakes we see here: people point their toes out. That's going to it's not going to work the right thing, and they have collapsed arches and stuff like that. So you want to make sure the toes are forward. Another thing, they'll put the foot either too far back or too far forward. Generally, you just want to feel, when the knee's straight, you feel it up here. When it's bent, you feel it down there. If you're having pain in the front, just don't do the exercise. Go see your physical therapist or healthcare provider. You don't want to have like a pinching pain in the front. That's usually more of a joint issue. So you want to feel a stretch down here. You don't want to feel any joint pain in the front. Aside from that, good luck with your Achilles tendonitis. Thank you.